This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Well, thanks for hosting this. We really appreciate it. My name is Ben Burnham. I'm one of the PGY4s and co-chief residents at the Cleveland Clinic. Logan Mag is the other co-resident, and he'll be monitoring the chat. So if you have any questions in the chat, feel free to send it along. All right. So our program is relatively new. It was founded in 2016 by Dr. Fred Frost, who was the chairman at the time, and Dr. John Lee, who was our program director. Around that time, we partnered with Select Medical as well, and our in-house rehab hospitals are then moved to three freestanding rehab hospitals. For the program itself, we offered 2 advanced positions per year. Nice part about being at the Cleveland Clinic is it's a world-renowned hospital system. So you get patients not just throughout the country, but throughout the world that are coming to get care here. So you get to see a lot of really rare and unique cases that come our way within rehab. For our rehab hospitals themselves, we've really been growing. This year we were ranked 38th nationally for rehab hospitals and #1 in Northeast Ohio. So it's something that we were pretty proud about because we worked pretty hard for that. For our program leadership, Dr. Beitu is our department chair. Dr. Geraldine DePool is our program director, and she just got this title earlier this year. Dr. John Lee, he was our former program director. He got a promotion to vice chair of education. He's great to work with. And then Natalie Douglas is our program coordinator. She really holds us all together and makes our world a lot easier, kind of trying to navigate everything. So we're relatively centered around Cleveland, but we do a little bit of traveling between 20 to 30 minutes from downtown for some of our locations. So our main campus is highlighted there. We do a lot of our outpatient clinics and our consults there. For our 3 rehab hospitals, we have Beechwood on the east side, Avon on the west side, and then Edwin Shaw, which is about 30 minutes south of downtown. We also spend time at our Children's Rehab Hospital just south of the main campus. We do our spinal cord injury and traumatic brain injury rotations at Metro Health Rehab Hospital. And then we also do spinal cord injury and prosthetics and orthotics at the Louis Stokes VA Medical Center. So for our 3 rehab hospitals, they're all standalone. And, they all kind of get your general bread and butter rehab patients that you'll see just about anywhere. But then they each kind of have slightly different focused patients as well. At Avon, that's where our liver transplant and kidney transplant patients go, as well as our LVAD patients. At Beechwood, our lung transplant patients go there. And then we're also putting together a cancer rehab line. Edwin Shaw, since it's more south, it's a little closer to Akron, and within the Cleveland Clinic system, Akron General is our level 1 trauma center. So you do get to see more TBI and traumatic spinal cord injury patients there. The other locations, it tends to be more non-traumatic brain injuries and non-traumatic SCIs that you have there. So throughout the presentation, I'm going to be highlighting different areas that we rotate at currently. But for you guys in the future, this is something you'll be experiencing. This is our new Neurological Institute hospital. It's going to be part of our main campus. It's slated to be completed in 2026. So it's something you'll see, something we won't see during our residency. But it's going to be brand new, state of the art. It's a $1.3 billion investment, and it's going to be 1 million square feet. So, just, really looking forward to that within the department and within the hospital. So just a brief overview of our rotations. So during your second year, it's primarily inpatient rotations. You'll do 6 months between our 3 facilities, and then you also do 2 months, so a month of SCI and a month of TBI at Metro Health, and then another month of SCI at the VA. You get a little different flavor of different settings at these locations. You'll have 2 months of outpatient rotations. It's usually spine or sports. It really comes down to what your preference is and what availability there is. But during the spine rotations, you get a lot of hands-on exposure during. I remember my PGY2 month I was on it. I think I did somewhere around 80 cases that I was able to perform or assist on. So you get a lot of hands-on exposure. You also do a month of spasticity management. That includes anything from Botox or botulinum toxin injections, phenol injections, backlift and pump management. Our attendings use EMG and ultrasound guidance, depending on the patient. So you do get exposure to different approaches. Then you'll do a month of consults at the main campus. For your PGY3 year, that's more heavily focused on outpatient. You'll do anywhere between 1 to 2 months on inpatient. You do a month of consults. In the background here, this is our sports health complex. This is the same facility that the Cleveland Guardians and Cleveland Cavaliers send their players. So sometimes you might see some of them whenever you're in clinic. So that's kind of a pretty cool thing. You also, get extra time for interventional spine or pain rotations. We have a comprehensive pain recovery program where you get to see ketamine infusions. You'll go to the VA and spend a month on prosthetics and orthotics. And then a large chunk of our PGY3 rotation is built around our EMG exposure. So you'll spend a month doing didactics with our neuromuscular fellows. And then later in the year, you do 3 consecutive months of EMGs. Then additionally, we do a month of pediatrics and then a month of electives to kind of fill in whatever you want to do, or if you want to take time for research month, you can. As a PGY4, you're kind of rounding out the ACGME requirements. So you need to have 12 months of inpatient total. So you'll finish up whatever inpatient is left over, or if you want to do more inpatient, you can do more inpatient. You also do a month of consults. Say 1 to 2 months of electives, but really kind of the rest of the time is elective as long as you're hitting those ACGME requirements. We do another month of pediatrics and a month of geriatrics. And then for the other outpatient rotations, you could do a research month. You could go and do some more sports rotations, get exposure to the 10-jet procedure, or really, whatever you want. Logan is setting up a rotation. He's going to Abu Dhabi because we have a hospital there. So he's going to be doing a cancer rehab rotation there. For educational opportunities, every week we get together with Metro Health for their didactics. So it's they sponsor it, and Metro, Cleveland Clinic, and University Hospitals residents get together for it. Twice a month, we have a resident board review where we just go through Cucurullo, make questions, and kind of review content with each other. We have a monthly journal club, and at least 4 times a year we go off-site and usually partner with another department. So this was us last year, partnered with our spine department, and we went over SI joint pathology. We have monthly chairman's rounds where we meet with our department chair, go over interesting cases. And then we also have our ultrasound curriculum. For that, we meet twice a month. We have 6 2-month blocks that are based on region. We start off with an anatomy lecture or case studies that's usually led by one of our orthopedic colleagues that tend to be, leaders within that special or within that field. Then we have a diagnostic ultrasound with our sports medicine doc, Dr. Mitch Cash, and then Dr. DePool leads our interventional ultrasound labs, which are done in the cadaver lab. So you get good hands-on time to just be able to practice that if you have limited exposure to it coming into it, which is pretty nice. And then we round out the series with a resident-led review where we just get together and practice scanning on each other. Additionally, we have a business and medicine lecture series. We meet 6 times a year for that, and it really, covers things outside of the clinical setting that you don't always get exposure to during residency. So anything, with billing and coding, working in different practice settings, whether it's, private, academic, community hospital, going over contract negotiations, leadership, all kinds of different things. We meet 4 times a year for bioethics discussions. Every 2 weeks, we have a spinal cord injury lecture by Dr. Nemunitis, who's pretty well known within the spinal cord injury field. We have monthly grand rounds, and as a PGY4, you do a presentation there. 4 times a year, we have our citywide grand rounds, where the 4 PM&R departments, so between us, Metro Health, University Hospitals, and the VA, we all get together and have a grand rounds there. And then throughout the year, we have all types of different labs. So last year we had a 10-jet lab. There's numerous spine labs learning, kyphoplasties, peripheral nervous system stimulators. I think we did like a SI fusion. And then also every week we have our sports fellows and spine fellows lectures. Their didactics are on Fridays. So if you want to, you're able to join those remotely to get extra education. So kind of the nuts and bolts. No one likes talking about call schedule, but I can tell you we really enjoy our call schedule. We do home call, which is pretty nice because you get to sleep in your own bed. So starting Friday night, you have your Cleveland Clinic issued work phone, and you just take any calls that come in from the hospital overnight. On Saturday and Sunday, you go in the morning whenever your attending wants to, usually around 8. And you round on any patients that need to be seen, and then you work on any admissions that are coming in. And then whenever you're done with the work, you're done with the work. We put 5, but it's not uncommon for us to be done anywhere between 2 to 5. If you're staying till late, that's usually a long day. And then after that, you go home and you just manage calls from home. Additionally, if you're on inpatient rotation, whenever your attending is on call that week, you take the home call on Monday, Tuesday, and Thursday night. That usually just happens once a month because they're on a every 4th week cycle. As a PGY2, you're on every 4th week. As a 3, you're on every 6th week, and as a 4, you're on every 8th week. That's the technical schedule, but a lot of the times we take less because a moonlighter covers our shift. So then we don't have to have call that weekend. We're responsible for 6 holidays a year, so just each resident takes 1 holiday. For time off, the fun stuff. You get 15 vacation days per year. You can take them however you want. They don't have to be consecutive. They can be broken up. You just want to limit it to 1 week per rotation. You get 5 sick or personal days per year. We get basically unlimited conference time, but we just limit it to 1 conference per rotation. And then we have 12 weeks paid maternity leave and 6 weeks paid paternity leave. For conference attendance, like I said, we basically have unlimited conference time that we can use. They haven't cut us off. They highly encourage us to go and present research. And this can be anything, from a case report to retrospective reviews, whatever you have. If you're a primary author and presenting, a poster presentation, you're able to get funding for it. So we have 2 sources of funding. GME will give you $2,500 per conference, and then our own department will give you $1,500 per conference. So you are able to get to 2 conferences per year. For benefits, these are the salaries that we have updated as of this year. They'll be higher by the time that you guys are going. But this is easy information to access on our website. Additionally, we get $1,000 from GME as an educational stipend each year. So not just total, but $1,000 each year. We get complimentary membership to AAPM&R and AAP. We have honestly a pretty awesome health insurance plan. As a as a relatively new dad, I can tell you it's pretty helpful for bills because it really keeps those down. And then after your PGY2, you're able to moonlight. For wellness, so everybody talks about different wellness activities and things like that, but I really think the biggest thing comes down to it is how the program treats you. And I can tell you that they understand that we're residents and we have a life outside of medicine. Um, I'd say we work anywhere between 40 to 50 hours a week, and our services are not resident dependent. So if we need to take time off to go to a doctor's office, or we're running late because you got to take your kid to daycare or something happened, our attendings are totally okay with it, and they're understanding of it. So that's the biggest proponent of wellness from there. Additionally, though, we do have a lot of fun things that go on. We have our Christmas party in that top right. At the bottom right, that was one of our journal clubs. Bottom left is our post SAE party. And then every year we have a fantasy football league, and the winner gets their name, quote unquote, engraved on the Frost Cup. So that is the brief overview. Give us a follow on Twitter and Instagram. Feel free to reach out to us there if you have any questions. I've got some quick snippets on why Cleveland, but I know that these are going to be posted online. So if you want to access it, you can do that. But it's a pretty great city, and I highly recommend it. So I don't want to take any more time for questions. I'll leave that open to you guys now. So if anyone has any questions, feel free to ask away.
We've got about 5 minutes left for questions, by the way.
There's no questions right now. I'm gonna run through why Cleveland, then, and if any questions come up, feel free to interrupt me. I don't mind. So within Cleveland, we have our Playhouse Square. It's the second largest performing arts center in the U.S., behind New York City. So you get all the Broadway shows that come through, big name performers as well come through. So lots of opportunities there. Our Cleveland Orchestra is ranked number 5 in the world. We've got a great nightlife scene, and our food scene was also ranked 7th in the nation. The flats are a great place to go on a weekend. If anyone's a baseball fan and know Tito Francona, he's the manager for the Cleveland Guardians. After a game, you'll see him riding a scooter down East 4th Street. The flats is a great spot to hang out. They have all types of nightlife and bars and clubs. And then at the bottom, you have West Side Market in the background. It's a great spot to get all types of different food that you'd want to buy. We have our Cleveland Art Museum and the Museum of Contemporary Art. We also have the Rock and Roll Hall of Fame downtown, and then just south, we have the Football Hall of Fame. They've really expanded this. I'm not sure if you guys can see my mouse, but initially, I grew up in this area. It initially just started off just with the stadium in here, but they've been expanding all of this, so it's a great spot. If you love nature and outdoor life, we have an awesome metro park. The green highlighted on this map are all the different parks within the area, so you're never more than 15 minutes away from getting out in the nature, being able to go hiking or biking or kayaking on a river. We also have the Cuyahoga Valley National Park. We have beautiful Lake Erie. It's the shallowest lake, Great Lake, so it's also the warmest, which is pretty nice during the summer. We love going to Edgewater Beach and hanging out there. We've got a great sports scene. So we have the Cleveland Guardians at Progressive Field as the number 6th ranked stadium among all U.S. stadiums. Cleveland Browns, we may not always have the best luck as a football team. Hopefully this is our year. We'll see. But we have a heck of a tailgating scene. The Muni lot, this top right picture is cut off and honestly pretty blurry. But it's like a 3-mile stretch of just tailgaters. So even if you're not a fan of the team, it's a great spot to go and tailgate and have some fun. The Rocket Mortgage Fieldhouse for the Cleveland Cavs was recently renovated, and it's a beautiful facility, great spot to catch a basketball game. And then, everybody loves saving money. So it is a relatively cheap place to live compared to a lot of the other big cities throughout the country. So that is about it. Anyone have any other questions or any questions?
We have about 2 minutes left for questions in case anyone has any.
Oh, sorry. I didn't see the questions in here. I just saw the chat. So fellowships, we have interventional spine fellowship, sports fellowship, neuromuscular fellowship. I believe there's like a neuro rehab fellowship for spasticity. For benefits, when it comes to tickets, we actually do. So I don't know about Browns and Cavs, but this year we got discounted tickets on Guardians. Still trying to learn that one. For the Guardians, I can tell you we were able to get seats on the third base line, 2 rows up, for $65 a ticket. So awesome deals. Do you have a board score or year of graduation cutoff? Not that I'm aware of. Yeah, I don't know of any board score cutoff that we have or graduation year cutoff. Characteristics that we think are considered when accepting applicants. We just want someone that's good to work with. It's everybody's really going to be qualified to come in and be a PM&R resident, but we want to make sure that you're someone that we can work with. We want to have a good team player, and that's kind of the biggest impact with it.